Next one, ma'am.
Okay.
Hello, Dr. Rekha in the clinic. May I confirm your name and age, please?
Yeah, I'm Sarah. I'm 40.
How would you like to be addressed?
You can call me Sarah.
Sarah, how can I help you today?
Well, actually, Doc, the thing is I had gone deep because I have a little problem with the way my privates appear, and
Mm-hmm.
so I feel my right side lip is a little bigger than the left. It's kind of embarrassing to talk about. But yeah, so I was hoping to have, just a small surgery could correct it. I did read up online about it.
Mm-hmm. Sarah, let me
Yeah.
reassure you that whatever we discuss here, it will be completely confidential. Okay, and we are here to help and support you in that situation. So, do you mind if I ask you more questions to know your situation better? Then I will be able to answer your question.
Yeah, sure. Why not?
Okay, so can you tell me that why you feel in that way that your one side is larger than the one?
Because I've checked it out. Mm. I've really
Mm-hmm.
seen it. I'm not imagining it. It's really
Mm-hmm.
wondering the right side is bigger.
Mm-hmm. Have you
And
noticed any
overnight
lump?
stuff. No, no, no lump. It's just the flap is bigger.
Okay, and
Mm.
any discharge or bleeding?
No,
Okay, and any issues with waterworks and bowel?
no,
Mm-hmm. Okay, so have you discussed with your parents regarding the same?
no. Of course not. I mean,
Okay, that's fine. And I want to ask some personal and intimate question, but it will be helpful to manage the plan. Is it okay?
yeah. What? Yes, right.
Uh, are you currently sexually active?
No, I'm in a relationship actually, George.
Mm-hmm.
But because of this, no, I feel confident and I'm holding back. Uh, so I feel like if I correct that, the issues, then
Mm-hmm.
I will be able to, start having sexual relations with him.
Mm-hmm. Okay, it's understandable. So, and have you received HPV vaccine?
Yeah.
Okay, and any health issues for which you're following your GP?
No, nothing of sort.
Okay, so sometimes in the women may experience such type of the things when they undergo any type of the physical or sexual or mental abuse, but it will be confidential. Do you want me to share something like that?
No, but I have not had any problems.
Okay, and any operation in the tummy and down below?
No,
Any allergies that you are aware of?
no.
And how's your studies going on?
Studies are fine. No issue.
Okay, and do you have good support at home?
Yes.
Okay, and how's your relationship with your family members and with your partner? How you feel?
Mm, my family members are fine, as it should be. And
Hmm.
my partner, as such, I mean, we've been dating for only 6 months.
Okay,
He's
and
good to me,
that's
treats
great.
me well.
Do you feel down, depressed, or hopeless?
No,
Okay, and your height to weight ratio?
it's 20.
Okay, thank you for sharing your all these information. Anything else important you want to add, Sarah?
Nothing comes to mind.
Okay, so coming to, is it okay if I examine you in the presence of a chaperone? Just to, as you are mentioning something like your right side is larger than the left side, so I want to look on that, but I will be gentle. And is it
See,
okay?
the GP has already done that. Didn't he write
Mm-hmm. Okay.
notes or anything? You can see.
I, yes, I find out that there is no gross abnormality. So, what do you think? What could be the reason behind this?
What could be the reason? I think as the way that I'm, born or formed, that there's something wrong.
Okay. So what we can do, the team of the doctors will be looking after you, including my consultant and the also psychologist. We will involve and also pediatric gynecologist, and we will also connect you with the counselors and support group if at any time you feel that you are not coping with the situation. So coming to the management option. So
Psychologist, why, doctor? Do you think this is ahead? I told.
Yes, for the if in future, um, I mean, I didn't do it as such type of station. I don't know how to do that. Okay, so coming to the management, as your GP did not find out any gross abnormality, uh, so I don't know, ma'am, how to do that. I
Okay. You have 4 minutes. A lot of
But
time.
I don't know to how to say the management about that because I don't know about anything about that.
Okay.
Mhm.
This is Dr. Rekha Sandeep, is it?
Yes, ma'am. Yeah.
Yeah. Okay. Because I can't always see the names of the people who are talking. Um, anyone wants to take over the management part or give it a try?
Ma'am, can I?
Yeah, sure. Can I know who it is?
Dr. Deepika.
Yeah, sure. Deepika.
So, Sarah, I would like to know why do you feel that something is wrong with your private parts?
Like I told you, doctor, I checked myself in the mirror. Yeah, I saw it,
Mm-hmm.
and it's really
Okay.
the right side is bigger.
Okay. So, so do you want
I just
some
want them to
surgery?
look more, more even and more beautiful, so I'll feel more confident.
Okay. So, so as a identity, what you see yourself as a boy or a girl?
What kind of question is that? I see myself as a girl, obviously.
Okay.
Nothing's wrong with me that way.
Okay. Yeah, sure. Have you been on any hormones?
No,
Mm-hmm. See, Sarah, it's everybody has everyone has their own individuality. They have their own private parts. It's nothing to be feel ashamed about that or something like it. We are all here to support you, and we respect your wishes. But at this age, your body is developing and is undergoing changes. So your body parts are still developing.
Hmm.
So,
Okay, I understand.
yeah, I would like to put you in touch with the counselors and the support groups, and even our consultants and cosmetic surgeons will be having a look to help you with that. But at this stage, your body is having changes, so it's constantly developing. So sometimes
Hmm.
you may feel that one some of the part is bigger and some is not, but anatomically, it's no, there is nothing wrong with that.
I see. Okay. What if I do
Hmm.
have like this? Obviously, I can't wait to be sexually active for such a long time, right? I mean, what do I do?
So it won't interfere with your sexual activity because what you're saying, you are feeling awkward with your outward appearance of your private part. I think you should talk to this about this with your partner, so you can both feel comfortable about that, and he can make you feel more confident about your body. So there's nothing to feel that about your body because everyone has its own variety or individual appearance of the private parts. So it's not what they show in the pictures or picture book like that.
Hmm.
So everyone, anyone can have variations. And before 18 years, we usually don't advise you to have any cosmetic surgery because your body organs, your private parts, they are still developing.
I see.
And
Okay.
if you, yeah, and even if you want to have surgery, because if you have surgery, they would be, and you want some of the part removed, so you can, there can be problems. You can have problems feeling the pleasure of the sex, or you can have pain in your private parts for a long time, and this can harm your psychologically also.
Mm-hmm.
And there can be
Okay, damn. Bro.
infection, delayed healing, and bleeding risks with that. And even after that, you may still feel awkward about your private parts
Okay.
because it's nothing to feel like about that like that.
Okay. All right. Yes. Yes, Dr. Deepika, you have gone through the talk. I can tell.
No, no, ma'am, I have not.
No?
It's from common sense point of view.
Common sense. Okay, I see. All right. Well, yes, but the talk also mentions a lot of points which are about common sense itself. Does anyone else have any pointers or they want to add anything with regards to this?
Age of boyfriend, ma'am.
In history, yes. So this station is less literature dependent, and a lot of other like social things will obviously that is just go through the cosmetic genital surgery talk released just last issue, I believe. So this they can phrase it in multiple different ways, but I found that this was one of the more challenging ways of putting this station up. So what you have to know is that yes, as Dr. Deepika rightly pointed out, there's more to do with the counseling and trying to find out why she's thinking the way she's thinking. You were off track before, like you asked about, do you think of yourself as a girl or a boy? That situation didn't come up. I mean, why were you thinking about GRS and other things? I was not asking for
Yeah,
gender roles.
actually, I got. Yeah, I got confused. I
I
thought that maybe.
Yeah, I was not asking for VRS. I was asking that my labia are unequal. They are not looking pretty according to me. And
You said
because
private parts, na?
yeah, so and that's the late term. No, 14 year. You remember you're talking to a 14-year-old child, and
Hmm.
that's extent to which she'll be able to describe her issues. She used words like flap and all that. So she can
Hmm.
say whatever, you have to interpret she said like one flap is bigger than the other, and she just said that
Hmm.
she wants to be sexually active. What are the other safety points which are there in this station? Like even if you are not able to talk her out of it, okay, what
Yeah.
other things are there? And this is, remember, those 10 minutes that you have are so precious. They are
Any
never going to come
medical
back.
history, surgical history, and her periods, how are the periods, any discharge from below, is she in relationship, any history of sexually transmitted infections, and
She's never
obviously age
been
of
like,
boyfriend.
okay, okay. Her boyfriend, yes, age
Age,
of boyfriend. Is there any okay? Those
we'll
are the
say,
kind of things that you have to.
um,
Yes,
is
so
anybody
very good.
body shaming her?
Great. Okay. Dr. Rekha, can I have Dr. Rekha?
Yes, ma'am.
So you asked in a kind of a sense that why do you think it is like that, or why do you think there is?
Hmm.
And but all I said was, I've seen it. It's one bigger than the other. Uh, Someone's child is crying in the bed. Could we mute that? Yes. Thank you. So there is a way, there is a,
Hmm.
technique of going around these kind of scenarios,
Okay.
and you have to be much more like open-ended questions which are there, and then closing on to sort of. Can we mute? I'm just going to mute everybody. It's a lot of disturbance. Mm, okay, great. So, coming back to, you introduce yourself, and Dr. Rekha, one thing I would like to point out, right, early on in the
Yes.
station,
Hmm.
you just introduce yourself like as though did a normal introduction.
Hmm.
However, when you have like a young person who might be a
Hmm.
little bit reluctant to talk about their issues when they are sexual issues,
Okay.
and
Yeah.
especially in modules which pertain to subfertility and
We
sexual and
need to ensure the
reproductive health,
confidentiality first. Hmm.
first, yeah. But
Hmm.
that does two things for you in the same
Hmm.
shot. One
Okay.
is not just confidentiality, you signpost and assure confidentiality in one go. No? Why you're
Hmm.
splitting it into two. Just now,
Hmm.
people are asking me, how do you make stations or presentations shorter? You have to
Hmm.
practice in such manner that all your sentences cater to one or two things together. All right.
Hmm.
So
Yes, ma'am.
first, you will say that I'm introducing Dr. So and so, Sarah, right?
Hmm.
Then may I confirm your age?
Hmm.
I understand that you were expecting to see my consultant today, but they are elsewhere occupied. Because the referral letter, there are three ways in which you can have this trap of consultant presentation being there. Okay, so you can have some background noise still. Kindly,
It's not mine, ma'am. Background.
I know, but I have muted everybody. Okay, thank you. So, you are then going to talk about the consultant, because the GP letter says that she's expected to see the consultant, or it may be written in your write-up, or
Okay.
once you enter the station, then
Hmm.
the patient might tell you that
Hmm.
I'm here to see the consultant. Are you the
Consultant.
consultant? So there are three ways this can happen. So
Okay.
in either of the situations, first be assured that mm, they you apologize for them not being there, and then you continue the discussion and maybe fix another appointment. This is the way to quickly go through that. And I can also reassure you that at the outset, we will discuss some personal questions which I may have to ask, but everything will remain confidential between you and me. Okay, so once that happens, there is one thing that awkwardness ice has been broken. Okay, so there is
Hmm.
a little bit more of uh, rapport building which is happening, and
Hmm.
also you have ticked off two boxes which are
Okay.
very important boxes in terms of
Okay, ma'am.
communication and patient safety.
Okay.
So that's how you get across doing
Hmm.
things. Hmm?
Hmm. Hmm.
Then I wasted a little bit of time there because I was like, this is a little embarrassing to talk about
Hmm.
initially when you asked me an open question and then you went to signposting. So
Hmm.
then I said, yeah, so what brings you here today? So that's the open question. And I said that my right lip is bigger, the left is smaller. I'm hoping to get a surgery. Can you help me with that? So she's already, now remember what's the situation is. She's been told by the GP that things look good. She's
No,
not
no, no.
happy, and he has reported. If you can see the language in which the letter is written,
Hmm.
she said she's insisting on it that this surgery is required for her and she wants to onward referral. So that's why it is referred. Hmm?
Okay. Yeah.
So likely that you know that the person, this child, is going to be a little bit more difficult to convince, maybe, and it is
Hmm.
going to be highly, reliant on good communication. Okay, this particular station, or a good negotiation and counseling which will be required for this station. So they listen to her problems. Firstly, do not invalidate her in any manner. So then definitely I would like to help you in this respect, and may have to ask you a few details about your personal life. Are you sexually active at present? That was very good. You asked about the sexual history. Has she ever been sexually active in the past? Okay, because you want to know where this issue is stemming from. So, how did she get the idea that
Hmm.
the right is bigger than left? So, okay, could you tell me how it is that you observed that this right lip is bigger? So then she'll be able to tell you that I saw myself in the mirror, maybe. Okay. Then you need to ask very specifically, is there any peer, like Dr. Deepika was pointing out, how did this thought come to her mind and what is reinforcing it? So get to the bottom of that and then you are through, because that is the catching point. Uh, That's what you are going to counsel her about. Find out how she has this idea. Just like in vaginismus, for example, in that station, we ask, no? So, has have you had traumatic experience? That's another thing. But if
Hmm.
how many vaginismus patients will have sexual abuse? Hardly any
Hmm.
actually do have sexual abuse.
Hmm.
They have a higher
Hmm.
incidence of sexual abuse. Not denying that, but
Hmm.
majority of the times, patients who have vaginismus may not have sexual abuse. So how did they
Hmm.
get that? How did
Hmm.
that fear firstly begin? So
Hmm.
this is so. Did you read or did anyone mention to you anywhere that this sex is going to be pink? So the same way you're gonna ask here, like, have you spoken about this? Not only why restrict yourself to parents? Have you spoken to parents, or have you spoken to any friends about this kind of things? And then, has someone mentioned or commented on the way they have appeared? Maybe when you have gone swimming, or like on the external appearance where you're in some changing rooms somewhere, right? So there is some sort of, you're trying to rule out peer pressure.
Okay.
Okay,
Okay.
what
Okay,
is
ma'am.
another source that kids look at nowadays rampantly? What is another source which educates children these days
Internet.
about sexual
Internet.
Google Baba.
internet? So you have to ask all these things to try and understand her psyche, where she's getting this information from, and then those will be the ones that will help you in order to counsel those things better. Like for example, if you know internet is the source of the research that she has done, and she has a certain mindset or a set specific idea what privates are supposed to appear like because she's seen them somewhere. Okay, maybe in some here in this situation, I had written that she sees on the internet, and then she's also watched some, because in preparation for the sexual debut, she has been doing some research, and she's looked at some videos, etc. And she felt, okay, I do not look like that, so there's something wrong with me. So that's where it, comes from. So there may be these kind of things. So you have to explore this basically.
Ma'am,
So yes, who's
I
this?
want to ask, like, how can we
Oh,
explore if she has any gender identity disorder?
she's not come to you with gender identity problem. Why do you want to create another issue for her? Like, why are you trying to confuse her? She
Uh,
identifies as herself. She's not telling you that I'm not, I don't feel like a girl. She's saying I'm a girl, but my problem is that they are ugly. Like, my privates are ugly
mm,
because they are unequal and they are not perfect. As per her
mm.
research, she's not perfect yet. So that's the thing. So you have to dispel
If
these myths. That
if
is
someone
what
else
the station.
comes with a problem of gender identity, then how do we ask?
The outright stating of the station itself will be that way, right? So they will, you know, tell you that such and such a person has presented with gender identity issues. Then your first thing there is, what would you like to be addressed as? What are your pronouns?
Okay.
Okay, ask straight away. Do not feel shy to ask these kind of things. What are your pronouns, or how do you identify yourself as? Because there may be multiple things now. Now it's not just
Mm.
transgender. Mm, it has become a huge umbrella under which there is fluidity of identity and other things also. So you ask pronouns, and you um, ask also as, please do not be offended. I want to know how you see yourself or identify as. What do you identify your gender as? This is how you can ask that question. Okay. So
Okay.
he or she is like, they will say that I am non-binary. If they say I'm non-binary, my pronouns are they them. Okay, or they may say that I identify as he, she, identify as a girl, right? Whatever, depends. Sorry, she, her, and that's a girl, and he, him is also a boy. Okay, it's become very complicated. But usually they'll give you from the lower spectrum only. Like, they will give you a proper transgender,
Okay.
or at least a non-binary. They are unlikely to give you the other weird uh, gender identities which exist now. Okay, so some after the section, coming back to the station, have you spoken to anyone else about these kind of concerns? Okay, don't restrict it to you should have spoken to parents or something, because again, that's like a little bit, for me it is like, no, I have not spoken to them, why should I, like, okay. So, and just to clarify, has your now here, do not use the word partner so often in young individuals. Okay, it's okay if
Okay,
she
ma'am.
says that I want to with my boyfriend. Okay, but
Hmm.
don't say partner, because these are not like stable. And she just pointed out that I've been dating him for the past 6 months, so you
Hmm.
know, that's it. Like, we don't know where this is headed. That way.
Okay.
So just to clarify, has
Hmm.
he or anyone else said anything about the way that your private parts appear ever? Okay. Then, have you attended sex ed classes? Sex ed classes typically, disturbance. Okay. Sex ed classes typically begin at the age of 11 to 12 in the UK. And so you can ask about that and see where the knowledge is coming from again. So your
Okay.
parents know about these concerns that you're having. And how are you doing otherwise with your studies, extracurriculars? So you want to know not only where it came from, but you
Hmm.
want to know the extent to which it is affecting her.
Hmm.
This background noise is irritating me. Okay, yeah, fine. So then, do you have any, as you asked, like the physical symptoms are there? Do you have any pain down below, or any difficulty wearing clothes or swimwear? These are legit reasons why somebody may, also seek cosmetic surgery besides the cosmetic reason. The cosmetic genital surgery might be sought for some sort of, like, if the labia are really grossly, abnormal, things like that, or they are causing some sort of issues for them to wear certain kind of clothing, or um, swimwear usually that we complain about, or them are causing pain, or dyspareunia sometimes, difficulty having sex, etc. So any problems with your bowels, waterworks, very good that you had covered. So, apart from feeling less confident about sexual activity, do you feel that this has affected your mood or your daily life in any way? Okay, so the effect of it you have to explore, because not only mentally, other issues also might be there, like social issues and things like that. Right, Dr. Rekha? Okay, so any other medical conditions you have, any surgeries previously, any height to weight ratio, and
Hmm.
do you smoke, alcohol, recreational drugs, all of these things? They can go quickly, or like you can finish off that. And then just think of further history. It's important. And examination, see, usually, typically, even previously, Dr. Fatima had mentioned examination. Unless examination has some value for you,
Hmm.
in terms of it will help you in terms of formulating the management plan, and it will help you or change anything in your diagnosis, only then it is essential to mention in stations. Okay, structured discussions is a separate case altogether, different case. But here the GP has given you, it is mentioned for a reason, no? They won't simply, they write the station very strategically, or put a lot of thought into how it has been structured. Nothing
Hmm.
is done
Hmm. We
just like
already
that.
mentioned, so we don't need to mention it. Okay.
Yeah, you don't mention.
Hmm.
Then she'll buff you off and she'll say, "No, this GP
Hmm.
already did that. You
Hmm.
just tell me
Hmm.
what I need to
Hmm.
do now."
Okay.
So that's very likely. So then you have to basically, even in the previous station, right now she is stable. She is not having any symptoms of recurrence, and nothing wrong with her. She's had a hysterectomy 3 years ago. What do you actually want to gain by the examination? Is there anything specific you're looking for from your history? So it is not going to help you counsel in any manner. You can entirely skip that. Saves another 30-40 seconds of your time. Okay, mentioning that entire thing. So
Got it.
I can see that the issue is something which is really bothering you. So try and, now speak on her side a little bit first, because this is negotiation finally. So I can see it is bothering you, and I completely understand. But please do not worry. I'm here to help you. Usually, for such concerns, the operation that is done, speak of this surgery. Now, if you tell me that we will first only like refer you to a multidisciplinary psychologist, then she'll be like, "Do you think this is in my head? Why are you saying such things?" And that kind of attitude. When she's young,
Hmm.
she's
Okay.
a child.
Okay.
So then you need to take her like nicely to your side and say, "Oh, don't worry, I'm here to help you only." And in this surgery that you are asking for, let us talk about that first. Okay. Briefly, you talk. Operation is called as labial reduction, something to remove the excess skin or fat that makes, the lips down below a little less symmetrical. So this can be there. But while it is offered to alleviate this sort of cosmetic concerns in some women, but there are some things that I want to share with you. If you allow me to talk to you in detail. So take permission for, even if she's young, no, don't discard her. You speak to her politely. Tell her like, I want to speak to you about this thing. So she'll say, sure, sure, doctor, I want to know. So then, firstly, one point is that she's still young. Good job on that, Dr. Deepika. You're still young and your body is still at a stage where it is developing. So the private parts, they are also going to grow and mature till around the age of 18, 19. Okay. In younger individuals, offering any kind of surgery like so early may mean that the lips will keep growing later or they change the shape later. And many times, then in the long run, young girls are not happy with the outcome that happens. Okay. So, what you're trying to do is tell her a biological fact about her body. Don't try to discard that, GP didn't say there was anything grossly wrong. So, that sounds wrong to my ears. I'm like, this doctor is not speaking in my favor at all, right? So, don't do that. That is something I would advise against. Okay, Dr. Rekha. So, as such, also, that there is no such thing as perfect private parts. Okay, it is usually seen that she would have told you that I have watched some videos, pornography, and things like that too, when you had asked her. So she here you need to tell her that as such there is nothing like perfect private parts, but there's usually what we see in it on the internet does not show what it should be, as in majority of the cases women, that they are very very different looking patterns and shapes or sizes, and all of these are normal. Okay, all of these are normal. Then offer to correct that, like give her a correct resource. Now if you read the talk, it says that the great wall of the vulva, that's one resource for people to learn from for this reason. Okay, so I could show you different examples via the internet, or there is a resource which is called as the Great Wall of the Vulva, which is available online for you to look at the variations which are there. These occur naturally itself. So as such, the appearance as assessed by your GP looks normal. What do you think at this point of time? All right. Now, but she might insist on this thing or the surgery again. You have to tell her that, as I've said, you're growing at this stage. The surgery for cosmetic reasons is not allowed. Okay, you must be above the age of 18 to legally be allowed for this consenting for such a kind of surgery. And even so, it is only done in the private sector. It is not done in the NHS yet. Okay, so as of now, it is not done in the NHS. Dr. Rekha, all right.
Ma'am, yes, clear,
Hmm?
yes. Ma'am, can you share the
So,
talk also in the group so that I can go through that?
okay. The other talk you have read on the previous station.
Yeah, other talk I know. Yeah.
Okay. So at the present time, for these reasons, it is advisable to wait, revisit your decision at a later point. And these procedures are also relatively new, and there is no strong evidence that the sexual function is improved. Okay, all long-term data is still not available. There may be harm like leading to painful conditions or pain, discomfort during sex, loss of sensation during sex. Okay, all these are possible side effects, and may end up that in the long run having regret. Just like hospitalization, you can have regret a lot of the times from having these surgeries. So these are all, then you start talking about the real life consequences of the problem. Like one is it dispel myths about the fact about perfect genitalia first. tell her physiologically why it is not offered to her, tell her legally why it is not offered to her, and financially as well. After that, you are now still talking about the pros and cons. While these are sometimes offered in order to uh, do a cosmetic correction for some women, but long term, we know that medically there is no strong evidence it can even improve sexual function, or still data is not available and can cause harm, painful conditions, pain during sex, loss of sensation, and side effects like long term regret. Okay, short term also the complications can be like
Hmm.
pain, infection, bleeding, the thick scar which can appear, other possible problems arising after the operation like difficulty during delivery, okay, difficulty passing or holding urine, and a chance of repeat surgery. So we have to do. So these are all your medical reason issues why you shouldn't do this.
Ma'am,
Okay, yeah, yeah.
if her
Who's this?
boyfriend is body shaming her, Dr. Deepika,
Deepika. Yeah,
if her boyfriend is body shaming her,
yeah.
then
Yes.
what to say? No one has right to.
No one has boyfriend is
Right.
body shaming about this particular thing. I think counseling
Hmm.
remains the same for you. Counseling remains the same. You have to the source of the anxiety is boyfriend instead of internet. What
Hmm.
changes for you apart from that?
So
Do you
he may not
don't
be
say
the
such
right person for.
yeah. No, 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 no. Too far. Too far as in it's you're not within your rights to say such things. All right. So you can say that uh, derogatory comments like these. Okay, what exactly did has he said or something like that? You find out if there is any component of grooming and things like that based on that. Okay.
Mhm. Mhm.
So like if the person was far elder to her or making her feel bad about this kind of things. You have to reassure saying that medically, see, we've done this things, and then there is no such thing as a perfect privates, etc. And the variations do exist,
Hmm.
and you offer not to talk as well to the boyfriend. You can say we can have another appointment with him as well if you would like me to explain certain things to him, then we
Hmm.
can talk it through.
Hmm.
I don't know. He may also have the same kind of he's learned from the same sources as this woman has, so
Hmm.
can happen. In reality, though, my boyfriend was not really forcing me for anything, and neither did he try to rush me to have sex or anything. But it's just that there was an anxiety. So, in this script, at least. So now, then see how she reacts at the end of all of these things. Then you have told her all the cons of going through the surgery softly, and then if she's still upset about it, say that I can arrange for you to see a specialist counselor because I can see that you are still kind of upset about this. We can guide you through this more effectively. Additionally, talk about if you're going to begin your sexual activity. Dr. Deepika to just recommended that you go ahead and have sex. Like, uh, go ahead. She was like, okay, fine. So you have to tell her that you must always remember to use condoms to protect against sexually shared
Hmm.
infections. Additionally, you can couple that with an added contraception to prevent pregnancy as well.
Hmm.
Okay, what we call
Other
as
things
couple
remain the
therapy.
same. Hmm.
Yeah, and I would suggest that if you find you're comfortable doing so, discuss the issue, okay, with your parents in an open manner, and that may be helpful. Like their input, sometimes reassurance from the elders, etc., really goes a long way into okay. But don't suggest this like you should talk to your parents. The way that you put it across is very important. I would just suggest, if you are comfortable in doing so, okay, then discuss. The same like anybody comes with a teenage pregnancy, you have to say that it's a suggestion, okay, depending on your comfort, you can do this. So
Even
then,
I had one patient in my OPD. She was complaining that her labia had grown over a few months. She has taken some medicine, and after that, so I explained to her it's not because of that, and everything is okay, nothing to be ashamed of. But still, she was not that much convinced, and she was adamant about surgery. I even explained her about the risk of surgery, and I don't know where she went.
sometimes in elder patients, the thing is that they come with a preset mindset of,
She was unmarried. She was worried that she won't get married because of that.
I see. Okay. All righty. Okay. So then obviously you document everything, write back to the GP about this thing, and give us some written resources about that. You can see the resource called as the Great Wall of the Vulva. It is basically plaster casts of different, external genitalia, which is formed in the form of a wall. Um, yeah. All right. Well, I guess these are the two topics I wanted to talk about today. And I think the sharing is off. Okay, so basically, let me skim through this, and if we've, yeah, kind of covered everything, right? Mm-hmm. Root cause of the assertion, quality of life, effect on mental health, communication, and yes, right. So these would be under your patient safety and applied clinical. Okay, right. Okay, guys. If there are no further questions, then
Ma'am, I want to know, please, if
call
you
it a
could
day.
put something, what procedures are not funded by NHS? Because,
Okay, I will share it in the course group.
uh,
Yeah. Alrighty. Thank you.